Right now, I want to welcome to the show from Doctors for Responsible Gun Ownership. Dr. Robert Young is with us. Dr. Young, how you doing, sir?
Hi, real good, Cam. How are you?
I am excellent. Appreciate you coming on the program. Ran across this a piece of the Huffington Post today by a doctor. The questions I can't ask about guns. Christy Rivers writing about this, and she said that she was at her kitchen table reading the medical journal that had arrived in her mailbox, and the sound of her 5-year-old son's voice shattered her concentration. She turned around just in time to see him point an empty plastic water bottle at her back. "The bottle is my gun, Mommy. It just shot out a bullet," she writes. And then she said she was unsure how to respond, but it was clear that we needed to have a little talk. Now, I find this fascinating because she uses this, Dr. Young, as a springboard to why she should be able to talk with her patients about guns. Now, she doesn't know how to talk with her 5-year-old child about firearms, and apparently she didn't until she was freaked out by something that happened in her home. But darn it, she has not only the right, but she has an obligation to talk to people like me about firearms.
Well, that's funny, isn't it? I just read this article, and actually, there's some really good points in it. But I think the point you just made is a really big one, which is she may be talking well to her child about its danger, and don't point it at people and stuff like that. But she acknowledges she doesn't have guns, she doesn't know about guns, and the only thing she could talk to her patients about is what her specialty group tells her to talk about, the AAP, the American Association of Pediatrics Academy, sorry. And as we talked last week, we in medicine, per se, as part of medicine, are not the experts on guns or gun safety.
No, you're not any more than I'm an expert on medical conditions. She writes here, she says, if you walked into my office tomorrow, I could not ask you if you have a gun in your home. I could not provide safety tips on how to secure a gun to keep your child safe. I could not teach you how to talk to your child about firearm safety. And she says, if I do ask, I could lose my medical license, face thousands of dollars in fines, or even go to jail. Here's the thing. I don't need somebody who doesn't know the first thing about firearms to talk to me about guns. I'm curious. Are there doctors out there, a doctor who would say maybe my patients could educate me on firearms, as opposed to them trying to educate us?
I hope so, and I appreciate you raising that because we really didn't get to that about my article last week. But really, that's another huge point. Physicians remember best the things they learned from specific patient cases. We all study the textbooks, and we're all shown a lot of things through training. But in our practices, our main learning is about that last case that stood out, or that last patient. And we do learn from our patients. Those of us who don't are really missing the boat. And if you're a person who is comfortable with guns, who knows how to handle them, and your doctor starts telling you things about that is not true, if you're not too intimidated, and that is a big issue, please, you go right ahead and you tell your doctor what your doctor needs to know about guns.
It's interesting because I've had some conversations with both my doctor and my dentist, who are gun owners, and we have wonderful conversations about firearms. But they, again, they're conversations; they're not lectures.
I'll bet they enjoy firearms like you.
They do, and and we have I talk with my dentist about going shooting with our kids, and we have great conversations about it. But again, they're conversations. They're not
right.
They're not lectures. They're not telling me what I should be doing and what I shouldn't be doing. And let's not forget, Dr. Young, that the biggest piece of advice from groups like the American Academy of Pediatrics is don't own a gun.
Well,
if you have a child in the house,
problem.
Then don't have a gun in the house.
Right. Some of the advice they have to give is appropriate about how it's ideal to store guns with their kids in the home. But they go on way beyond that, and with statistics that we talked about last time that looked at make no sense and do not add up about it being so dangerous, simply that there's a gun existing somewhere in the vicinity of your home. That's absurd because that's epidemiology, but you can't apply that to individual situations where the issue is not some infectious agent out of your control, but your own responsibility to make decisions about how to manage items within your control.
Absolutely. Dr. Robert Young with Doctors for Responsible Gun Ownership, thank you, sir, for coming on the program. It's good talking with you this afternoon.
Anytime, Cam. I enjoyed that. Thank you.
Me too.